So again, you would sort of end up talking to patients who are obese, and they would, when they sort of opened up to you, they would be depressed, they'd have anxiety, they'd have other mental health problems, or they'd have emotional difficulties. They'd have, very profound, histories of abuse and so on and so on. And there'd be many, many different reasons why people were obese. But it wasn't just because they were daft and didn't realize eating cake would make them fat.
I wanted to talk quickly about how we were talking about eating disorders and how it's not about food or body composition, it's about control. At the other end of the spectrum, if you will, with obesity, quite often it's not about hunger, right? People aren't eating because they're hungry, they're eating because they're sad, they're depressed, they're anxious, social pressure, boredom. All of these other factors are contributing to people just taking on more calories than they need. Given your extensive experience in addiction, do you think we need to treat obesity in the same way we treat alcoholism or gambling or any kind of drug addiction? Are there a lot of parallels that maybe we're missing some opportunities to find some ways of treating people?
That's a really good question. I mean, I would say obesity is never about hunger, because nobody needs to be obese, essentially. Aside from incredibly few people who have unusual genetic or hormonal imbalances, which actually they can be treated separately. So actually, there is no reason ultimately, from a purely biological perspective, to be obese. So I would say that obesity entirely is a psychological problem. And actually, when I worked in the eating disorder service, for 10 years, I ran one of the service for obese patients, trying to differentiate people who were obese, so would have what we call volume eating, so just eat too much, versus people with binge eating. And actually, it's I felt a very artificial distinction, really.
Okay.
And now, if you in this country, if you get a diagnosis of binge eating, which is a very clearly defined kind of criteria around how you consume food. So you have normal food, and then you have distinct periods of binges where you feel out of control. You don't do a compensatory behavior like purging, like making yourself sick or over exercising. So you just have these periods where you binge on large volume, and sometimes patients with quite extraordinary large volumes of food. And so if you got diagnosed with binge eating, you would be treated psychologically. And yet, if you just simply didn't eat in a binge pattern, but you just ate too much, we would say, sorry, go off to Weight Watchers. There's nothing we can do. And actually, it used to break my heart, because I used to sit there thinking, but actually, you talk to these people, and it's clearly they have an unhealthy relationship with food, or an unhelpful relationship with food. They're using food to self-soothe, to manage their emotions, to reward themselves, to do all of these things. It's serving a psychological function. And we know that simply telling people don't eat so much, exercise more, we know it doesn't really work. Now, on the face of it, it should work. It's easy.
Yeah.
Because, I mean, it's like, the body in many ways is complicated, but actually in other ways, it's really straightforward. It's simply energy in and energy out. And if there is a disparity between that, if you're putting more energy in than you're taking out, then the body stores that extra energy, and it stores it like as fat. I mean, it's a very sort of basic, straightforward principle. The fact that even saying that sometimes is controversial, I find, that's another topic. But I mean, it's just a biological fact. And of course, yes, different people have different metabolisms, but all that means is great. You're really lucky. You have to put less energy in. Brilliant. Like, aren't you lucky? So actually, you don't have to actually eat as much. It doesn't mean, oh, that's my excuse for being fat. It just means you just need to eat less. But of course, we know that it's not that straightforward, that it's not that simple equation, because actually what that equation doesn't allow for is the mental processes that go on in our relationship with food. And so this is the thing. So I would say we should absolutely, just as we understand that cigarettes, alcohol, drugs, all sorts of gambling, all sorts of other behaviors are serving a profound psychological function. That's why people do it. It's serving a psychological function, therefore we need to treat it psychologically. I feel like the NHS has really missed the trick, and actually society in general, I don't just mean in this country, I mean all around the world, has failed to understand that, again, we have put our brains in this extraordinary situation, the first time ever in human history, where we have access to more calories than we actually need. That is unheard of in human evolution. So we put them in this, so they're already, because we've spent most of our existence as human beings our ancestors spent most of the time starving.
Yeah.
So we already have this propensity to, you know, if there's more calories, take them on board. Actually, what we've now realized is that we've put people in an environment where they have access to more calories and there's this propensity to take on more than they actually need anyway. And we've surrounded food in this kind of rich cultural and social kind of milieu, which means that actually food ceases to just be about energy for lots of people, and is actually about a lot of other things. So again, you would sort of end up talking to patients who are obese, and they would, you know, when they sort of opened up to you, they would be depressed, they'd have anxiety, they'd have other mental health problems, or they'd have emotional difficulties. They'd have, you know, very profound, you know, histories of abuse and so on and so on. And there'd be many, you know, many different reasons why people were obese. But it wasn't just because they were daft and didn't realize eating cake would make them fat.
Until we treat obesity in the same way we treat any other addiction, are we fundamentally flawed in our approach, and we're just going to see a continuation of obesity rates, not only in adults, but also in children?
Yeah. Well, we know that it's not working. We know, you know, the government, or, you know, not just our government, governments around the world, pumping millions upon millions upon millions of pounds, billions of pounds into treating obesity, and it doesn't work. And actually, all we see is just the rates going up and up and up and up. So if it did work, to me, I feel it's a failed experiment. It's like, well, we tried doing this. We tried sending people off to this place and this place and this place. We tried telling them to do this. It just doesn't work. Now, of course, there are some people for whom that messaging, for whatever reason, does resonate and does work with them. I suspect, from my experience, a significant number of those people actually have done it psychologically. They've shifted for whatever reason, whatever's happened. It's been a psychological shift, and then that information, or that the course that they've been sent on, has landed just at the right time. But we know if you take the general population, you tell them not to eat so much, to exercise more, it doesn't work. So to me, I think we need to kind of change the approach. And yes, I think we need to treat it maybe more as addiction. The thing that becomes maybe a bit more controversial is, just as with addiction, we treat, say, somebody who's addicted to heroin, you would hope, with kind of compassion and understanding, but we also locate the problem very much in them, and we say, actually, it's you that needs to do the work, and you need to change. This is something that we understand why this behaviour has occurred and evolved in you, but actually we're not going to pretend it's anything else. We're not going to blame wider society, etc. Ultimately, even though there might be lots of complicating factors why somebody uses heroin, ultimately, you know, when you work in drug services, as I have, it's quite a harsh environment. People are quite strict. You know, the drug services are very aware of people looking for anybody else to blame apart from themselves, the situation they're in. And again, it's difficult using words like blame, or maybe I suppose about taking responsibility for the situation. And one of my concerns that I've seen, I think, a lot, again, with the kind of rise of social media and so on, is that there's been this kind of very bizarre shifting where, on one hand, we've got incredibly skinny, unrealistic, idealized versions of the body being presented and so on and so on. And that's been affecting people. But then equally, we've seen this kind of romanticization, fetishization of obese people and the obese body. And I kind of get it, because it's in contrast to, it's an offset, this very unhealthy messaging. But actually, we're not, that's very unhelpful. But if you're then also saying to people, actually, the reason that you are overweight is because of an unhealthy relationship with food, and let's think about how we can deal with that. If we've also then got a whole group of people saying, you know, fat is fabulous, fat can be healthy, etc., etc. Again, it's that very complicated messaging that's going to confuse people. And also, if your brain is going to want to listen to the bit that's saying, actually, don't bother changing, you're okay, don't take responsibility, it's all right, like, you're actually fine, because change is always uncomfortable and difficult. So for me, yes, we need to treat it psychologically, but we need to be mindful of doing it in a compassionate way, but ultimately saying to people, you do need to take responsibility for this. And it's only you that can change it. Nobody else can change it for you.